Hello listeners, welcome to Views on Health. On the program tonight is Dr. Kelum Jayasinghe, consultant gynecological oncologist at the Teaching Hospital Mahamudra, down south in Galle. A warm welcome to Doctor to our studios, the first time that you're being featured in this series of programs.
Yes.
And for the information of our listeners, as a consultant gynecological oncologist, Dr. Kelum Jayasinghe focuses on female cancers. Without any further ado, over to you, Doctor.
Thank you very much, Fatima, for inviting me for the health topics today. And we are going to discuss briefly about the female genital cancers. Going into the topic, we will discuss what are the most common female cancers. As you all know, the breast cancer is the commonest female cancer in Sri Lanka among female. After the breast cancer, next one is the thyroid cancer. Next one is the bowel cancer. Then other three cancers, which are my favorite. The fourth one is the cervical cancer. The fifth one is the womb cancer. Sixth one is the ovarian cancer. I'm dealing with, in my specialty, which is called gynecological oncology. I'm a VOG specialized in gynecological malignancies. That are cervical malignancies, ovarian malignancies, womb malignancies, as well as vulval cancers. And for us to say it's cervical cancers and womb cancers and ovarian cancers all accounts for more than 1,000 patients per annum in our country. And these patients also causes lot of burden, especially with the cervical cancer and ovarian cancer. And we go on about cervical cancer first in brief, then we will little bit about the endometrial cancer, that means womb cancer, and then about the ovarian cancer. Cervical cancer usually it's a only preventable gynecological cancer. It is caused by a virus which is called human papilloma virus. There are more than 100 subtypes of the virus is available. High-risk strains only cause the cancer. More than 95 to 99% of cervical cancers caused by human papilloma virus, which is preventable because we have the vaccination for the virus. And human papilloma virus generally recommended after 8 years of age. After 15 years, in Sri Lanka, which was introduced to our national immunization program in 2017, where school-going age girls getting the vaccine in year 6 and 7. And sadly to say, the take-up of the vaccination is only about, both doses, only about 50% in our country. Even though it was given freely to all school-age going girls, the vaccination take-up is 50%. And first dose is take-up about 70%. The second dose, that means completion of vaccination, is only taken by about 50%. Therefore, we have long way to go with vaccination and prevention of cervical cancer. The next step of cervical cancer is the early detection of the cancer, for which we have a Well Woman program, where we screen all the females in their cervical cancer using pap smear test, which also take up is in our country around 50 to 60%. Even though the service provided by the Ministry of Health, free of charge to old ladies at the age of 35 and 45 as a 2 cohort, but the take up of the testing is about only 50%. Then we miss lot of opportunities to detect the cancers early. Therefore, our ladies, when they are present with cervical cancer, only 10% in early stage. Other 90% is in a late stage where the curable surgery is not possible. I'm a surgeon which I operate on cervical cancers. Only 10% of patients at presentation we can offer surgery at least. For the rest of the 90% straight away need chemoradiotherapy, which will has if done in a proper manner can cure the disease. But the problem in our country is the limitation of resources, where the radiotherapy facilities and other facilities is not available. Sometimes ladies need to wait for about more than 3 months get to the radiotherapy in our country, because one form of radiotherapy is called intracavitatory or the brachytherapy, which is available only in Kandy and Maharagama Apeksha. The queue for that is usually about 3 months. And that is the sad part of cervical cancer in current scenario in the Sri Lanka. But I think one reason for ladies to present in late stage is that they are not aware about symptoms as well as signs. The facilities available for them to prevention as well as early detection. Prevention is done by the HPV vaccination, which can be taken 8 to 15 years, but the vaccination can be taken for sexually naive ladies up to 26 years of age. If they are not sexually active, up to 26 years of age, they can have the vaccination. But the problem, they need 3 dosing regime rather than 2 doses. They need 3 doses after the age of 15 years. That means 15 to 26 years, they need 3 doses of vaccine, which can be arranged in private sector, even though the government sector not facilitate late vaccination. But people who are interested, it's a good thing if you can get the vaccination. With regards to the early detection, our people is aware about the Pap testing, but they are scared to go to the well-woman centers and get them in screen. There are so many problems with screening also. One reason is delaying reporting, because some people not interested, because when they go for screening, the report will not come back for them for about 6-9 months. But if you have really interested in screening, you can get the screening done in private sector also. The cost for Pap smear is about 5,000 rupees. And the sensitivity of Pap testing is about 50%. But the thing is, Pap testing need to be done repeatedly. Other developed countries, for example UK, from 25 to 49 years of age, every 3 yearly, they are screening cervical cancer using cervical smear testing. That means Pap testing. Other than that, they also do high-risk HPV DNA testing at the same time. Every 3 yearly up to the age of 49. Then 50 to 65 years, every 5 yearly, they screen their population, whole population. But in our country, we do 2 cohort at the age of 35 and 45. But the participation for that cohort is about 50%. That means we are missing already 50% of females. And the other thing is, if you go for Pap smear, you need repeated screening. For example, every 3 to 5 years. But here we are screening only in a 10 years gap. That is also not with full potential. Therefore, there's a lot of scope for improvement with regards to early detection also. If the patients or the client can be affordable, HPV DNA testing is the way forward, which give instant result. Within about a week, PCR testing can give the results. It can subtype the types of viruses. What are the viruses positive? in your genital tract, and which kind of a HPV DNA virus is positive, whether it is 6, 11, 16 or 18. High-risk viruses are the 16 and 18, which cause about 70% of cervical cancers. We account for 70% of cervical cancers. All the other high-risk types account for the rest of the cervical cancers. That is the important thing for us to be aware about the screening and early detection using Pap testing or the HPV DNA testing.
Thank you, Doctor, for introducing the topic of female cancers and with your focus on cervical, womb and ovarian cancers. It's a bit alarming that though the facility for vaccination is available, freely available, it's not being made use of. So I think that is sort of the mindset and the myths that people have about getting such vaccinations. We just don't know how they think about it. But unfortunately, I think sufficient awareness has not been created to show them that it is safe, and that therefore, and it is important to get it done. Unfortunately, it's not mandatory. If it's mandatory, then they will do it. Like the other vaccination when a baby is born, they have to give all those vaccinations over a period of time. When it comes to this point, for a young girl to get this particular vaccine is safe.
Yes.
Other it won't be given. That we know. We are very sure about that.
Yes.
The government won't allow it.
Yeah.
So, but unfortunately, the people are diffident.
Yes. I think more important that public awareness with regards to the safety of the vaccination, because people are worried about the reactions and the very allergy reaction basically about the vaccination. This is a very safe vaccine. Very, very rarely the reactions has been reported, but those are not life-threatening reaction. For example, bit of itchiness on the side and bit of a swelling, those kind of minor reaction has been reported, but no major reaction. This vaccine has been tested for long time. And for example, governments such as Australia, which is freely immunizing not only girls, they immunize boys also. Because this vaccine also related to cancers in oropharynx as well as anal rectum as well as vagina and vulva. Therefore, a lot of cancers involved with human papilloma virus. Therefore, it is very, very important to get the vaccination. And UK also vaccinate the girls with the HPV vaccine. I think our way forward is to improve the awareness among the general public, the importance of this vaccine. As a person daily seeing people with cervical cancer, I can see how they suffer when they develop a cancer which is not inoperable sometimes. Because sometimes we are limited with options, because they develop the cancer around the age of 30-40 years. Those are very young age. The other thing about the cervical cancer, they don't die with the cancer. They suffer a lot with cervical cancer, because cancer is spread locally, the cervical cancer. That means from the cervix it's spreaded to the surrounding tissue. Then when the cancer is spreading laterally, it goes to the lateral pelvic wall. Then it involves ureter, which is the tube which is draining kidney into the bladder. Once the ureter is involved, the ureter can get obstructed. Then we call it uremia. Then they get developing breathing difficulty. Then they have, because all the waste can't go out because the urine can't travel, then they get accumulated in the body. Then body start to swell. As well as they get lot of pain because of that. Then further, when the cancer spreading further backward, it causes involvement of the sacral nerve roots and the nerve plexus. Then they get lot of pain. And those kind of scenarios be very, very difficult to treat. Sometimes those can be life-threatening also. But usually this cancer, then they develop into fistula formation. That means it goes to the bowel and anteriorly goes to the bladder. And those times the communication between the bladder and vagina or the bowel and vagina can happen. Then without their knowledge, they start passing stool and urine through their vagina continuously. And it is like living in a hell. It's basically they suffer a lot because of fistula formation. Therefore, it's very, very important for our ladies to get aware about the cervical cancer and make use of the vaccination as well as make use of the early detection through pap smear or the HPV DNA testing. I think it is vital. On the other hand, symptoms. If you are sexually active, when you are having sex with your partner, if you are having bleeding, you don't have to hide that. You need to come up to your GP or the VOG or your gynae-oncosurgeon, go and check yourself. That is the most important pathognomic symptom for the cervical cancer. It's called post-coital bleeding. If you are having sex, after the sex you have the bleeding, then you have to be vigilant and get yourself checked. Then we can detect early stage in cancers.
Thank you, Doctor. It's so interesting, and also it's alarming because the facilities are available to prevent it, but they're not being made use of. And it's a vast population that is not getting the facility for whatever reason. 50% is a lot.
Yeah.
And then as a result, the medical personnel, your colleagues and all level of health workers are involved in treating patients and taking care of them in the hospital. Or if they're at home, the family has to do it, or they have to have a caregiver. So all this put together can be avoided if the steps are taken initially. So like you quite rightly said, Doctor, we are aware that awareness is what is very important here. Now, I'm just asking you because if you take a school, now this is a school going age where you're going the first vaccine. Can't the health workers in every area, in district wise, going into the smaller towns in every district, reach out to the schools and explain the importance of getting this vaccine for the girls?
Ministry has a separate division about the public health awareness, which is mainly involved with medical officer of health in that area. They do school health education programs. They do school health screening programs. And every school they arrange this human papilloma virus vaccination program also for the grade 6 and 7. And but the problem is parents need to give the consent for the vaccination. Then if the consent is not there in the school program, they can't vaccinate a child. Therefore, parents need to be educated about the need of this safe vaccination.
The importance of it.
Importance and the need. Because I have seen a lot of patients in their 30s, they come up with, because of, as I said earlier, once the surgery, only 10% of patients with cervical cancer present at the stage of where the surgery is an option. That means in an early stage. Lot of them are present in late stage where the chemotherapy as well as the radiotherapy is the mainstay of treatment. But the problem with the radiotherapy, because of lack of resources, we have delays of treating patients. Then the recurrence, that means cancer coming back again, is very common. I have seen couple of ladies in their 30s with the recurrences, which is, I'm sad to say, we can't offer anything for them. We can only offer palliative care, that means symptom control using pain medication and putting a stoma to the fistula and those kind of things only, nothing else. no curative on. The problem is the family they are leaving behind, because most of them are very young, 30s and 40s, and they are leaving behind small kids. Can you imagine, Fatima, losing a mother at that age, how the impact for the kids and the survivors of that family? I think that is the most burden we are unseen.
I know, Doctor, it's when you explain, I'm just visualizing situations where young mothers are going to lose out on their precious lives because they haven't taken care ahead to protect themselves from getting a cervical cancer. And when the facility is available. And of course, as you say, it's too late if only 10% are operable. The rest 90% is a big number, are going to be at the mercy of, medication. What more can you do?
Yes.
So back again to this program of the Health Ministry and the MOH. Yes, if not the students, they can reach out to the parents, can't they? And also make them realize the need.
Yeah.
Maybe the parents would have lost out in certain parts of the country.
Yes.
And so they may think, well, I didn't get it, I'm okay, why should my child get it? It could be that mindset. Yeah,
that might be one reason, because this is a very recent, 2017 only we started this program island-wide. But I think at that time there were a bit of awareness going on the TV advertisement and other things, and radio advertisement. But nowadays I hardly see anything about the advertising. I think it's all of our responsibility, because this is the only female malignancy which has been proven to be preventable. That means we are, for the last 10 to 15 years, every year we are getting nearly about 1,200 female per annum in our country. That should not happen, because this is a cancer which can be prevented. It has shown with evidence in other countries where a good cervical screening program is available, for example Australia or the UK, where they see very hardly a cervical cancer. They detect everything very early stage. That means the cervical cancer, once you get the vaccine virus into your body, immediately you won't get changes in the cervix. The virus only there are studies done in Sri Lanka. Only 3 to 8% of our females has the HPV virus in their body at a given time. Not all these 3 to 8% develop the cancer. Only the persistent infection need to be there to develop into a cancer. The process of normal cell to become a cancer cell will take about 15 to 20 years of time. During this 15 to 20 years of time, there are lesions which are called pre-malignant lesion. That means pre-cancerous lesion, which can be detected during the screening program. That is the aim of our screening with pap smear and HPV DNA testing, where we detect a bit of a cellular abnormalities in early stage, which are called SIN1, cervical intraepithelial neoplasia stage 1, stage 2 and stage 3. These early lesions, these lesions can be detected very early, and we can act on them. While taking some surgical action, we can remove that abnormal part before even they develop into cancer. I think that is a very important thing about the screening. And vaccination, what will prevent is the infection. Therefore, I think the way forward with cervical cancer is to improve our vaccination in the country, as well as improve the participation for the cervical screening program. And people who are having insurance and affordability can go to the places where the HPV DNA testing is available, can get themselves tested. I think that is the way forward in our country. I think early detection is the key. it's very good to detect pre-cancer than a cancer. And because always we are detecting advanced cancer, that is not the case in Sri Lanka. I think our literacy rate is more than 96%. The people who can understand things, I think best thing is for them to be aware. Cervical cancer is a preventable thing by vaccination as well as screening. Screening you have to do at least every 5 years with pap smear or the HPV DNA testing. If you have that HPV DNA positivity or the precancerous lesion, go to your gynecologist or the gyne-oncosurgeon, get yourself treated for your precancer if needed. Then we can prevent the burden of cervical cancer.
Thank you, Doctor. Interesting. And I sincerely hope that all the efforts put in by the health officials, as well as you and your colleagues, the consultants, towards creating the awareness and treating patients will certainly bear fruit. Thank you, Doctor.
Thank you very much for inviting me for this discussion.
It's our pleasure. Thank you, Doctor, again. And so we place on record our very grateful thanks to Dr. Kelum Jayasinghe, Consultant Gynecological Oncologist from the Teaching Hospital in Mahamodara in Galle. Thank you once again, Doctor, and we look forward to your presence on our program in the foreseeable future. Thank you. My thanks also go to Prabha Veerasurya for technical assistance. I'm Fatima Razikad saying good night and looking forward to your company next Monday same time on Views on Health.